Welcome to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, and we're excited to talk about how doctors can actually monitor spinal cord activity during surgery. How is this possible?
For a long time right now, we are practically moving technologies that allowed us to visualize the human body. There were the X-rays, then there were the MRIs, then they got a little more aggressive. They start to use arthroscopes. Then now they're using special scans. And recently they are modifying the scan and is a mobile type of scan that travels around the body and can practically allow the surgeon to see the areas that the naked eye will not be able to see.
Why is it important to happen during spinal surgery?
Well, because it's a tremendous amount of difference in the treatment of a spine. When I read this article, I go, well, this is a millions of dollars expenses in an instrument we can do cheaper and better. Mm-hmm. Maybe not with the tremendous technology and all the fancy things that you would need to use. The arthroscope can do the job. And the arthroscope is cheap.
Okay.
Then the tubes that we developed in our institute many years ago allowed you to travel wherever you want to go if you really know where the problem is. Mm. And that one can be done by studying the patient problems and the locations of the problems. And once you know where you are, the arthroscope will be your best friend to take a look together with those tubes. So in spine surgery, it's amazing to see how poorly the results are and how bad the developments are coming through.
You mean just in general?
Yeah.
Okay.
When you do spine surgery, you expect that the patient will be okay. Well, this article that they're talking about is a mobilized scan that moves around, but it's for back pain. They are trying to cure back pain. I can cure back pain in an hour.
Right.
With the techniques that we develop.
Yes.
And really the cost is, in comparison, almost
minimal.
Zero.
Correct.
So when you start to talk about back pain, one of the things that we do at the Institute is remove back pains every single day.
Right.
And the results are permanent, and they are excellent results. And the damage in the spine is minimal. But they're also talking to do these type of procedures. When you do spine procedures, you need to put the patient to sleep. Because when you talk about certain advances right now on the market, they are talking about to use fusions. And they talk about minimal invasive fusions.
Okay.
What is a joke? Because it's not minimally invasive.
No.
Because you need to do a cut in different levels. And then after that, they need to put rods and they need to put some type spacers.
So now I see where you're going with this monitoring device. They're spending millions on it, which means the skyrocketing prices of fusion spine surgery, when yours can be done, as you said, through the arthroscope and then those dilating tubes that you developed. And with your specific procedures, you have minimal cost and you're able to do all of that with your conscious IV sedation. So really, this is just a waste of money and something to cause those prices to skyrocket.
We know that it's around 30% of the humanity has back pain. And reading articles and something, they describe that is uncurable. The problem is you need to know the anatomy and you need to understand where the problem is coming, and that is what you need to correct.
Right.
Okay, I just have experience yesterday in a patient who had another problem. And another surgeon came and asked why I cannot fix this pain. And then we worked together and we fixed the pain in an hour. So the problem is you need to know where you need to go.
Right.
I am extremely blessed because I have 80,000 procedures. So I have a tremendous amount of knowledge because every patient taught me something. And everyone who taught me something, I apply to see if I have a repetition of that result.
Right.
And I do. And when I do, I use it. My patients have what we call today conscious sedation,
Yes.
and it's not that is the way that everybody should operate the spine. And it's not there.
Correct.
And when you start to see these fusions, I understand why they need to do general anesthesia. Because if you need to put the instrumentation on the stomach through the abdomen, and then you need to go through the back, and then you need to go to the side, yes, the patient needs to be practically dead before you put all these things there.
Yeah.
The problem is you don't need that.
Correct.
My patients come to me with tremendous different types of problems and are being solved very much in the same way that I do the procedure. And the procedure, the result of this procedure is beyond what the market delivers today.
Correct. It reflects 98.75% patient-reported satisfaction. If you would like to find out if you're a candidate for the exclusive and patented Bonati spine procedures, visit askbonati.com. Thank you for watching American Medicine Today. Make sure you check us out anytime, anywhere by downloading our American Medicine Today app on your streaming devices.